dramatically. And that is most concerning, because while our hospitals today can handle the disease load, that curve is very steep, essentially as steep as it has been in most of the previous waves, and unfortunately is consistent with many of the, if not all of the places across the United States that are similarly experiencing the attack of this Delta variant. We know the dominant variant today is the Delta variant. It is twice as infectious. It is more likely to cause serious illness, and it is easily the most dangerous mutation to date of this virus. And we know that this curve is trending upward. You might think of this as a new virus in some sense, given how different it is from the previous virus mutations. We would have liked to have thought that when we have reached this level of vaccination that we would have blunted this virus. But it turns out the science shows us that the mutations that have occurred in this virus are significantly more infectious. That makes it very clear to us that there is one way out of this pandemic, and that is more vaccinations. But until we get more people vaccinated, we've got to be cautious, and that's what we are being today. So it is unfortunate that we are in this position because we have the tools to beat this. We have the tools to break the back of this COVID pandemic, but there are too many people who, although they have access to a free life-saving vaccine, have not availed themselves of that. It is an effective, safe tool. We know it works, but we have challenges getting enough people actually taking the vaccine. I want to show you our vaccination rates on, I don't know if this is daily or weekly, but you'll see that in April and May, we were hitting numbers in the 60,000 a day number, and that has declined dramatically, where we're down in the single digits, mostly on per day numbers. Those numbers need to improve dramatically if we are going to get to a level to break the back of this pandemic. Unfortunately, it is also very disparate in our vaccination rates from county to county. I'll show you our county numbers to show the difference. You'll see that it is a high of San Juan County for those over the age of 12 that are eligible for the vaccine of 81.4%. That goes down to Garfield County to 31.7%. That disparity is dangerous, and most dangerous in these communities that have these low vaccination rates, because we have seen across the country similarities between low vaccination rates and high infection rates. We want to save every life in the state of Washington, east and west, urban and rural. And so we have some more work to do. So I think the challenge is we have to realize there's not just one virus in our state, there's two. One is the COVID virus, but the second is just as deadly, and that's misinformation. Unfortunately, too many of our citizens have been attacked by misinformation, much of it on the social media, which has caused them to ask questions about the vaccine and have blunted the ability for people to save their lives by getting this vaccine. Now, we are trying to bust those myths that have been perpetrated on social media, but I do encourage anyone who has a question about the vaccine to talk to your medical provider. Those are the people with the know. And we have started a program called POP, the Power of Providers, where physicians are working with us to be willing to share information with patients. The more people do that, the more people will make a decision that will save their lives and those love them. Now, this is frustrating because we are past the point in this pandemic where the general public should have to deal with more restrictions. Because more than 1 billion people worldwide and hundreds of thousands have had the vaccine safely in our neighborhoods and in our country and in our state to show that this is a safe vaccine. But we remain optimistic because we know people can change their minds. We know people, when they get the right information, make decisions to get the vaccine. And most importantly, we know everyone wants to save lives of the loved ones around them. So this just isn't about your life, it's about people around you. And as we think about this, we are confident going forward. Now, there's one very important unvaccinated group that cannot use this life-saving tool, and that is our children under the age of 12. I know many parents are concerned about their young kids. We all are. And this is one reason why we're going to make some decisions today. So we are today announcing we will continue as we open our schools, and we will open our schools this fall. We will continue our existing policies regarding masking. So all students and employees will be required to wear masks around each other in the building, regardless of their vaccination status. This simply maintains our existing requirements for schools. Importantly, this is a legal requirement that all districts will need to follow. We have to prevent the spread of COVID, obviously for the health of our children, but we also want to keep our schools open. We don't want to see waves of this virus going through the schools and force the closure of these schools. Our kids need to be in the classroom this fall. Now, if we can turn these COVID numbers back, we can revisit these obviously in the future weeks and months. But right now we know that this is a significant risk and we have to respond to it. This is consistent with the CDC guidelines they just announced, but it importantly is simply a continuation of what we previously done with success in the state of Washington. So certainly while this virus is increasing is not the time to decrease the protection of our young children. We will protect our young children. For those who've hoped that we would not have to continue that mask requirement, I certainly understand that frustration. But these trends are getting worse. And let us recognize the reason for the necessity of this. It is because not enough people have been vaccinated. But we ought to be optimistic that that is in our power to change. As people get more information, they can make a decision to get vaccinated for their benefit and their families. We believe that that will happen. We simply need to accelerate the rate of that decision making. So obviously we need to think about masking for everyone in the state of Washington. So we are recommending statewide that people consider wearing a mask regardless of their vaccination status and give thought to the type of conditions when you are indoors about wearing a mask regardless of vaccination status. This is only a recommendation. It is not a legal requirement. I know it's frustrating for people to even have to think about that, but that's the situation we are in. And the more people that get vaccinated, the less we'll have to think about this. Look, this vaccine works. And frankly, it is maddening that we have a life-saving medicine that can save people's lives that's free, that we still have to be in this position. And we can all do something about that, not just getting vaccinated, but to talk to our loved ones about getting vaccinated. And we know that because we know that the CDC has shown there's increasing evidence that even vaccinated people can transmit this disease, and that's the basis of the recommendation. That new evidence makes vaccinations more urgent, both the evidence that this is more transmittable as a variant, but also this new information that CDC has shared with us that even vaccinated people can transmit the disease to other people. Now, that's not to say this isn't a life-saving vaccine. It is incredibly effective, incredibly effective. The vast, vast majority of people who are in hospitals today have one thing in common. They're unvaccinated. 96% of all the people in our hospitals today have one thing in common. They didn't get the vaccine. We want to drive those numbers down. Now, we know this has always come in waves, but this is more like a riptide. We hit some major milestones in the summer, but we can't go backwards. If our hospitals are overrun, it won't be just those who have COVID who are affected. Those who have heart attacks, those who want to go to the ER, those who have traffic accidents would not have adequate medical care. We simply can't get back into that risk. So we're not done fighting this virus. We're going to keep it up. We should have an attitude of defeating it. We should have an attitude of protecting ourselves while we're doing that. And we should have an attitude of optimism that the more people get the straight scoop, they're going to be more comfortable with this vaccine. With that, I'm joined by Dr. Shaw. Dr. Shaw, I'm looking forward to your comments.
Thank you, Governor. Can you hear me okay?
You bet. You bet.
Well, thank you for leading on this. And I just want to start off by just really thanking all Washingtonians for helping us fight this pandemic. And I especially want to appreciate those who have done the right thing, which is, if eligible, gotten vaccinated. And I think the governor is really pointing out the key message today, that vaccines are so critical to the success of all of us in the state of Washington. As the governor said, we're seeing increased transmission across our.
We lost you there for a second, Dr. Shaw. We're looking for a technological fix here. Our crack team is diagnosing this as we speak. Dr. Shaw, our evaluation is it's a problem on your end at the moment. I don't know if you want to try a different phone or something. Why don't we give Dr. Shaw a few seconds here?
Okay.
There we go. We can hear you again, Dr. Shaw. We lost you for a minute and a half.
Hear me now?
Oh, you're gone again.
Can you hear me now? All right, give me one sec here.
Yes. Okay.
Okay. All right, well then maybe I'll keep my comments brief.
Unfortunately, they're too brief. We just lost you again. Pardon? I'm sorry. Okay, Dr. Shaw, we're going to move ahead, and why don't you work on your connection? We'll come back to you in a few minutes. I want to make some further comments, and we'll try Dr. Shaw again. A couple good things happening in our state. The child tax credit is now available. I want to ask people to be aware of it and hope that they can apply if they're eligible. This is a tremendous step in the effort against childhood poverty. But unfortunately, there is a report that we're not getting people who are eligible who are actually applying for this. So we'd like to encourage everyone, especially anyone who may not have had to file taxes in the last 2 years, to make sure they're included in getting the credit. The easiest way to do this is to go to the IRS website at irs.gov, and look for the Child Tax Credit Non-Filer form, or contact a local IRS office directly. We're also very hopeful that the Congress will make this a permanent proposal. We appreciate our legislators, certainly Senator Murray and others who are working so hard on this. I want to congratulate our former counsel, Nick Brown, who has been nominated to be the United States Attorney for the Western District of Washington. Fantastic choice, super qualified. He has all the intangibles you'd want in a public service. He did so much for our state and our service, and I know he'll do well for the Department of Justice. Lastly, I want to offer our whole state's condolences to the family of Clark County Sheriff Deputy Jeremy Brown, who was lost in a tragic shooting. And not only to his family, but to his staff at the Sheriff's Department and the whole community. He was a 15-year veteran of the office. He was known as a tremendous leader in helping train other officers. He's a former State Department of Corrections employee whose entire career was committed to law enforcement. Our hearts are with the Brown family, and I hope everybody will recognize the extent of that loss and the difficulty this profession faces. With that, we'll try Dr. Shaw again. Dr. Shaw, are you there by chance? For some reason, we're not picking up Dr. Shaw. I would encourage Dr. Shaw if you can call Stacy and see if we can figure out some connection while we're working on this. With that, why don't we go to questions, and we'll try Dr. Shaw again a little later. Oh yes, Lacey is on. Lacey, do you want to say anything? Dr. Shaw's absence? Doesn't sound like it.
Sure, Governor. I can go through quickly just a few key points. I'll start with what is included in the school guidance. You heard the governor mention a requirement that schools continue to wear, that students and staff in schools continue to wear masks. We also recommend 3 feet of distancing. However, distancing shall not prevent schools from offering in-person instruction to all students who want it. This is a recognition of the value of in-person instruction and not a change from the guidance we released in May. However, there is more flexibility in areas outside of the classroom than that previous guidance. In addition, there are some updates to quarantine for schools that will hopefully help more students stay in classrooms to reduce time out of in-person instruction. So I can stop there and see if Dr. Shaw has been able to join, and we can take questions.
Okay, don't hear Dr. Shaw. Lacey's comments, we want to make sure kids are back in school this year. These efforts are designed to do that, both by preventing infections and by having flexibility in some of these rules to make sure our students are back in the classroom. Personally, we're looking forward to that success. And thanks to all the educators and the parents who worked so hard on this. They've done a remarkable job in really, really difficult conditions. With that, happy to stand for questions.
Governor, it was announced today that New York will be joining California in mandating vaccination of state workers or else subjecting them to weekly testing. Given the concern about not enough people being vaccinated here in the state, as you just stated, do you plan to have those same requirements for state workers here?
So that type of thing, we know we have to increase our vaccination. That's a certainty. The question is how to do that in a reasonable way. The type of measures that you're suggesting are some that we are considering. We will be involved in the future days in conversations with the broader public, with our employees, with their representatives, with our agencies to see whether that makes sense for the state of Washington. But one way or another, we do have to increase the rates of vaccination. So those will be under consideration.
And for Lacey, can we get an update on the statewide vaccination rate that includes the federal numbers? And then also as it relates to vaccine supply, hundreds of providers in the state have J&J doses that are about to expire in the next 2 weeks. Can you talk about how the state is preparing to deal with that? And what are your thoughts on potentially having to toss out so many vaccines as cases are going up here and as other places are having very limited vaccine supply in other countries?
For the question so the first question was just, I didn't quite hear the overall state vaccination coverage rate. Is that what you're looking for?
Yes, that includes the federal number.
Lacey, she was asking for the best number we have that would include the information from the federal government on federal vaccinations.
I can pull that for you in a moment. And then the second question was J&J supply. So, you know, the supply around the state in Washington and federally has shifted to a demand system. Our providers are really great about using their vaccines. We also have processes to transfer doses among providers in Washington state, and that helps us manage things like the J&J expiring doses. We also are in regular communication with the federal government about, you know, the possibility to extend the expiration date on that piece. For our overall vaccination rate, including, I mean, the best estimates we have are our own data, and that is because we use a more recent population estimate from OFM as opposed to the denominator the federal government uses, which is a bit older. So our current rate is one moment. Why don't we go to the next question and I'll get it for the governor in one moment.
So Lacey, can I just have you kind of follow up on, are Are there concerns that if the expiration date isn't extended or you're not able to reallocate some of these vaccines, the real potential that you may have to toss tens of thousands of doses of vaccine?
Well, we want to use our doses as efficiently as possible. I think, we encourage those to be used by Washingtonians stepping forward to get vaccinated. And then, otherwise we're working with our providers to move them around, or, of course, the federal government to get them to other places that need it.
Governor, we are.
Yeah, why don't we pause, see if we can get Dr. Shaw in here. Joe, if you can hold on just a second.
Yeah. Can you hear me okay, Governor?
We can hear you. Go ahead.
Okay, perfect. Sorry about that. I apparently have a bandwidth issue, so it's my video. So now I'm on by audio only. Apologize for that. And you can still hear me okay?
Bet.
Perfect. All right. So let me start over and just keep it brief. As Governor said, we are seeing increased transmission across Washington, and that should concern all of us. We know that vaccines work. We also know that masks work. We know together they help people stay protected. We're seeing the Delta variant more so than ever in our state, and that's similar to what we're seeing across the country. Vaccines and the protection from vaccines are still holding steady. They still work. They're still effective. They're still safe. But this increase in transmission across the state should be a wake-up call to all of us. As you all know, the CDC yesterday announced a number of different things they were looking at across the country. That was an important announcement. This pandemic rages on. It's not stopped impacting people. And so what we want to do is make sure, as the governor said, that people across the state of Washington really consider wearing a mask in public spaces indoors, especially when there is more transmission in the community around them and or they're not sure what's happening in that indoor space. Those who are vaccinated, let me be very clear, are largely driving this increase in transmission across both the country and the state of Washington. But we also know that we have a way to be able to help all of us, and that is to get vaccinated. If you are still waiting to get vaccinated, we're encouraging people, it's easier than ever to get vaccinated today. And we also are saying that if you are in a situation where you are fully vaccinated, thank you, but please encourage somebody else to get vaccinated as well. As the governor said, we're substantially in alignment with what the CDC is thinking. We have increased disease transmission across the state. We recommend that people consider wearing a mask statewide, even if they're vaccinated, because there simply are just not enough vaccinated people out there. Let me close just by saying that, as the governor mentioned, that 96% of hospitalizations among COVID-19 people were in those who were not fully vaccinated. That should concern all of us. And that should be a call to action for all of us to get vaccinated. It is absolutely critical that we do this across the state, but we're also very concerned about our children. And that's why when the governor mentioned the school guidance and the change in the school guidance, at least the maintenance of the school guidance, is really, from our standpoint, so critical, because we know that it's important to protect our young ones, and we're going to do everything we can to do that. And let me just also finally close by saying that there is a way out of this, which is that as we're seeing increased transmission across the state, we are concerned that it is certainly in many pockets of our state where people are not fully getting the message that really, if we want to end this pandemic, we do have to get vaccinated and do whatever we can. We have launched a number of initiatives, as the governor mentioned, including the Power of the Provider. Talk to your doctor, talk to your healthcare provider. We've also doing mobile outreach. We're doing everything we can to work with our local health jurisdictions, our tribal vaccine partners, our private sector. And until we get more Washingtonians vaccinated, we need to continue to remind people to consider wearing a mask when they're in public indoor spaces. Governor, with that, I'll just turn it back over to you.
Thank you. We solved this.
Governor, you said Delta variant's more transmissible. You said we're entering a fifth wave, big vaccine discrepancies by county. Dr. Shaw just said the pandemic rages on and there's substantial transmission across the state. Why aren't you doing the mask requirement? Why is this voluntary?
Well, it's voluntary for a reason that, number one, some people got vaccinated in the hopes that they'd be free from wearing a mask. Well, we want them to essentially continue that benefit, if you will, to encourage more people to be vaccinated. So we're mindful of that some people got vaccinated because they didn't want to wear a mask. We want to, to the extent we can, honor that benefit of becoming vaccinated. We also think there's a significant possibility that we're going to increase our vaccination rate. Now, as I've indicated, we are going to be considering doing some things in the upcoming weeks that we will believe will be effective to increase the vaccination rate, because we just can't have unvaccinated people injuring their fellow citizens. Look, people who are unvaccinated right now are a danger to their fellow citizens. They create a risk to their fellow citizens. And that's a danger that we can't ignore. So a combination of wanting to honor this incentive that people thought they got from the vaccination, and the fact that we are going to be more assertive and I think more effective in the upcoming weeks of increasing vaccination rates, we think that's the right approach.
But given the upcoming weeks, and then if you can get the vaccination rate boosted, then you still got a couple weeks or a few weeks lag for we're talking about substantial more numbers of people being vaccinated in case it could go up pretty fast.
Yeah, well, I think that's true. Obviously, these things do take time. You point out an important fact, but that's one of the reasons we're acting early. Look, the reason we have been successful saving tens of thousands of lives, the reasons we have not had our hospitals overrun like other states have, where they had to put people's remains in refrigerated trucks like other states have had, is because we have acted earlier. So we're acting in some sense early on this fifth wave so we can avoid that and have time for these new measures to kick in before our hospitals are overwhelmed. We have some weeks to accomplish that. It's not forever, but it's some weeks. So in the upcoming weeks, we are very hopeful that people will talk to their physicians, learn the truth about this vaccine. You don't grow antlers out of your forehead when you get this vaccine. You get your life saved, and you stop being a risk to your neighbors and your family. That's what happens. And when more people talk to their doctors, that's what they're going to find out.
Governor.
Yeah, Dr. Shaw, go ahead. Go ahead.
Yeah, I just wanted to make sure that we also reminded our media partners that the secretary order for those who are unvaccinated, who are required to wear masks in public settings, that indoors, that order is still in effect. I think the challenge we've had is simply the people who are unvaccinated are just not doing the right thing by wearing the masks as well. And that's the requirement. And so that does not change. But I do think, as the governor said, this is based on the information we have based on transmission and what we're seeing across the state. This actually continues to be, in our minds, the right step at the right time to be able to protect Washingtonians. But the requirement for unvaccinated people to wear masks remains. And we want to make sure that that is also known for those when they're out and about, that they've got to be able to protect others around them as well as themselves.
Important point. And people need to realize this is a legal requirement on the employer. So the employer has a legal requirement under our labor and industry rules to require their unvaccinated